Imagine feeling constantly exhausted, no matter how much you rest. You stand up and suddenly feel dizzy, like the world is spinning. Your body's losing weight, even though you're not trying. And strangely, you start craving salt. This isn't just stress, this is something much deeper. This is Addison's disease. Now, let's understand what's really happening inside the body. Addison's disease is a condition where the adrenal glands fail to produce enough essential hormones. The most important ones are cortisol, and aldosterone. Cortisol helps your body respond to stress, maintain energy, and regulate metabolism. Aldosterone controls your salt, water balance, and blood pressure. When these hormones drop, everything starts to fall apart. Let's start with the symptoms. One of the earliest signs is extreme fatigue. Patients feel tired all the time, weak, and unable to carry out normal daily activities. At the same time, there is unexplained weight loss. The body simply cannot maintain its normal energy balance. Another major symptom is salt craving. Because aldosterone is low, the body starts losing sodium. And when sodium drops, the body desperately tries to compensate by craving salt. That's why patients often feel an unusual desire for salty foods. Now, here's something even more dangerous: postural hypotension. When a person stands up, their blood pressure suddenly drops. This leads to dizziness, lightheadedness, and sometimes even fainting. Why does this happen? Because low aldosterone means low blood volume and poor blood pressure control. Another key symptom is abdominal pain, along with nausea and vomiting. This makes the condition even more exhausting, both physically and mentally. And then there's one very unique sign: skin hyperpigmentation. The skin becomes darker, especially in areas like the palms, creases, and underarms. This happens because the body produces more ACTH, trying to stimulate the adrenal glands. But ACTH also stimulates melanin production, leading to this darkening of the skin. Now let's move to diagnosis. How do doctors confirm Addison's disease? The first step is checking cortisol levels, especially early in the morning. Normally, cortisol is highest at 8 a.m., but in Addison's disease, cortisol levels are low. Next, electrolyte levels are checked. You'll typically see low sodium and high potassium. This combination is a major red flag. Another important test is measuring ACTH levels. In this condition, ACTH is elevated because the body is trying harder and harder to stimulate the failing adrenal glands. Then comes the ACTH stimulation test. This is one of the most important diagnostic tests. A synthetic ACTH is given to the patient, and cortisol levels are measured. In a healthy person, cortisol levels will rise, but in Addison's disease, there's little to no increase. This confirms that the adrenal glands are not functioning properly. Other tests may show low aldosterone, low blood sugar, and increased renin levels. Imaging like CT or MRI can also help identify the underlying cause. Now let's talk about treatment, because this condition can be life-threatening if not managed properly. The first priority is correcting volume depletion. Patients are given intravenous normal saline to restore blood volume and stabilize blood pressure. If blood sugar is low, it must be corrected immediately. This is done using dextrose solutions. Next comes hormone replacement therapy. This is the cornerstone of treatment. Patients are given glucocorticoids like hydrocortisone to replace cortisol. They also receive mineralocorticoids like fludrocortisone to restore salt and water balance. And finally, the underlying cause must be treated. For example, if the cause is tuberculosis, appropriate anti-tubercular therapy is required. So in simple terms, Addison's disease is a condition where the body loses its ability to handle stress, maintain blood pressure, and balance essential electrolytes. But with early diagnosis and proper treatment, patients can live a normal and healthy life. And that's why recognizing these symptoms early can make all the difference, because sometimes fatigue is not just fatigue, it's your body asking for help.